There are many types of therapy that can fall into the category of bodywork. Some examples include massage, chiropractic care, cupping, acupuncture, myofascial release, neuromuscular therapy, craniosacral therapy, and total motion release. I have recently started training for total motion release and am excited to incorporate this technique into my practice. Total motion release, or TMR, involves assessing biomechanics, uncovering root causes behind physical limitations or ailments, and completing treatment through active movement interventions that target specific body areas to release blocks in mobility. This is then followed by intentional therapeutic activities to organize and realign the body through sensory integration, and completed with targeted muscle activation to allow movement and stability through the newly acquired range of motion. This technique allows clients to improve their body movements and gives them the ability to utilize this new movement in a functional way for lasting improvement. The mobility limitations that are present could be based on intrauterine positioning, the birth process, or they could develop later in life based on acquired movement patterns. TMR techniques are safe to be used for treatment in patients of all ages, including infants. Its purpose is to realign and reposition the body to allow for natural movement patterns to resurface. This can sometimes be hidden under other acquired patterns. Once we restore the alignment and mobility, we can then introduce treatment interventions, including strengthening, to develop the muscles needed to maintain the new position. This is where it's imperative to be seen by a trained clinician. As a PT, I have the knowledge and experience to help patients of all abilities improve their strength and postural stability. An example of a treatment session would include an assessment of body mobility at the start of the session, targeted interventions to improve mobility where needed, a realignment activity to stabilize the body in its new position, and it would end with treatment interventions to build strength within that new alignment. There is evidence to support the use of TMR in infants with torticollis. It can be a great tool for the infant population as it's a no-tears method of treatment and utilizes active movement to improve range of motion. It involves the caregiver and includes a specific home program to continue to improve range outside of treatment sessions. If you are in search of a more comprehensive approach to treatment, we would love to hear from you. You can find us online at emergepediatrictherapy.com or call our front desk to schedule a consult with one of our clinical directors to find out more about our services. Thanks. Have a great day.